Greetings, my name is Dr. Janet Isrouche. You were directed to watch this video for your pre-op surgical planning, and this is in hopes to facilitate a very smooth start to finish pre-op, operative, and post-op course. So first let me start with the requirements prior to getting to this step of surgery. At this point you would have completed your necessary labs, as well as a history and physical completed by your primary care physician, and or completed it at a facility for pre-admission testing at either Beaumont or St. Joe's Hospital or the Dearborn Surgery Center. The pre-op diagnostic work can involve labs or further diagnostic testing such as MRI, CAT scan, chest x-ray. Secondly, the other thing that is new for our pre-op workup is the COVID-19 testing. The COVID-19 testing can be completed at the hospital facility where you will be having surgical intervention or an outpatient lab setting. So if you're in a surgery center, it would be preferably done at the closest hospital to that surgery center, and it needs to be completed 24 to 48 hours in advance of your surgery. For example, if you are having surgery on Friday, I highly recommend that you get your COVID testing on a Wednesday. If you are having your surgical intervention on a Monday, you should have your COVID testing done Saturday. It does take some time to get the results in, but if they're within the 72-hour window, the test would have to be repeated. In addition, there are two types of tests that you can get for COVID-19. One is the nasal swab, which I'm sure you are familiar with. That could be done in a drive-through setting at either Beaumont or St. Joe's 2 days prior, or you can have serology testing done, and that is through a simple blood draw. So if you're going to have your blood drawn for the surgery, we can add serology testing onto that, so you don't have to do the nasal swab as well. It will be less trips that way. You might want to ask your primary care physician if they offer serology testing or nasal swab testing at their office, especially if you're getting your surgical clearance through your physician's office. Otherwise, you can get everything completed through pre-admission testing. At any point, if you have any questions or concerns during your peri-operative course from start to finish, that means pre-op, during, and post-op, any questions regarding that, you're more than welcome to contact the emergency line, which was given to you when we discussed surgery in detail. And that line is 313-319-9299. Again, 313-319-9299. Thank you, and I wish you a very quick recovery.